I don't see you eating so much when you're there. You're quite discreet in the picture.
We can go, can't we? Are we
Let's
ready
wait
to go?
for a few people to come in, to join, and 10 seconds, you can start. Start.
Yeah, that's 40 participants.
Well, good afternoon to all of you here in the room and to all of you online. I'm Graham Alabaster. I'm the head of the UN Habitat Office here in Geneva, and it's my pleasure to give a couple of remarks on behalf of the UN Habitat as one of the co-conveners of this meeting with WHO and Global Cities Hub. The subject of urban health has been part of UN Habitat's DNA for many, many years. Even when I started with Habitat back in '92, there were some of the early stages of the collaboration, believe it or not, under a sort of One Health banner in those days related to vector-borne disease, and I was part of that from the early stages. Over the years, of course, we've seen quite a lot happen between the two agencies. But I think that over the past probably 5 or 10 years, there's been an acceleration in a lot of the work we do together. Partly, of course, because the majority of people are moving into urban agglomerations of different types, but also because there's a whole range of different disease threats now in urban settings. We all, of course, recently remember the pandemic, but as people urbanize in different parts of the world, the dynamics of urbanization is, of course, influencing disease patterns. And of course, now with climate change, we are seeing, particularly with infectious diseases, lots of changes. So the threats are getting more and more. The urban space is becoming more and more crowded. We know that by 2050, nearly 3/4 of the world's population will live in an urban space. And of course, that's all rather worrying. But the important thing is that of all of the urban dwellers that exist in 2050, about 60% of the urban space has not yet been built. So we have a huge opportunity to influence the way urban space goes ahead, and an opportunity to try and design in or design out many of the diseases, common diseases that are related to that have a spatial relevance and urban planning. So on the one hand, yes, the non-communicable diseases are important because urban spaces need to be designed to promote healthy lifestyles. But then also for infectious and communicable diseases, we need a much better understanding of the interaction between the formal and informal parts of the city to look at the inter-urban differentials. So I'm not going to say anything more other than to welcome you and I'm looking forward very much to this discussion, and just to say that Habitat, of course, is a real trusted partner with WHO for many years, and we want this collaboration to go to the next level. And this meeting today is very much a part of that process. So thank you very much.
So thank you very much, Graham, and I'm just gonna build on Graham's introductory note to also welcome everybody on behalf of WHO. My name is Nathalie Rebel. I'm the WHO cross-cutting lead for the work on urban health. And as Graham was saying, we have a very long-standing collaboration with UN Habitat, and we are very grateful to Global Cities Hub for co-organizing this very important event. And maybe just to reiterate that obviously the issue around urban health is not new to WHO. It has a long-standing tradition. Actually goes back, if you go to the 60s, where when we're looking at environmental risk factors, there are some reports that really show how the importance of environmental risk factors was particularly identified in urban contexts. So when we're looking at air pollution, water and sanitation, the importance of looking at this in the urban environment was acknowledged. And then over the years, obviously, the role of cities, the role of urban, has been increasingly being taken up by WHO's programs. You may know that WHO has a Healthy Cities program with a very long-standing tradition. in the European region, but then has been taken up by all the other regions of WHO. We have other healthy city networks focusing on specific vulnerable population groups like aging, etc. And obviously, as things evolve, technical teams across the house, and just to build on what Graham was just saying, colleagues working on non-communicable diseases, communicable diseases, emergency preparedness and response, more and more recognize the importance, right, of looking, on one hand, of the role of cities to addressing global health challenges, but also the importance of looking at key urban determinants and how they do affect health and health equity. So all this to say that while WHO has this long-standing tradition in looking at urban health issues, there was a real shift in the last couple of years where there was a recognition that urban health not only had to be embedded in the technical areas, but actually had to almost be a standalone theme. And therefore, a couple of years back, a new stream of work, an urban health work, and I have the pleasure of working in this area, has been established with the idea of bringing together actually the different areas work together to provide strategic advice, but also to frame the different activities under almost one head. And I think that this has been an important move, first of all, to elevate the agenda, to also give visibility to the agenda, but also to give different mechanisms to work specifically with local governments. And then this has also been an instrumental move to also strengthen collaboration with UN Habitat, as we are now, having this joint event, but also with other UN agencies and partners. The fact that there was this recognition of the importance of urban health as really a stream of work, a strategic approach that the organization had to follow, actually opened, if I could say, some more formal engagement mechanisms with UN Habitat and partners. So this event today and the opportunity to exchange, to also hear your opinions, partners' opinions about what has been achieved, but also where to go, is extremely important for us and will be an important element for the new global program of work that we have in WHO, where determinants and addressing risk factors are one of the key priorities. And obviously, with populations living in urban environments, this is particularly important. So thank you very much, and very much looking forward to the discussions.
Thank you. Thank you so much, both Graham and Natalie, for that. My name is Anne Touzon. I'm the co-director of the Global Cities Hub. And for those who don't know us yet, because probably you know very well WHO, you know very well UN Habitat, but you don't know us, we are an organization that pursues two objectives. The first is to better connect local and regional governments to the United Nations and other international organizations here in Geneva, a little bit beyond as well, to enhance the influence of local and regional governments and state-led multilateral processes. And the second objective that we pursue is to promote the urban work of international actors, encourage them to work with local and regional governments, and also support collaboration between different international organizations on urban issues, because you all know it, our future is urban. So we're very proud to partner today with UN Habitat and WHO to host this workshop, and hopefully where we will engage in a very meaningful dialogue to explore urban health challenges and opportunities, from the standpoint of both this organization, but also a little bit beyond. We're very fortunate today to be joined by a very distinguished group of experts, both around the table, but also online. Thank you for being there. Special thanks to Natalie from WHO, special thanks to Graham from UN Habitat for your long-standing collaboration. Let me also thank Andras, who has been absolutely instrumental in making this event possible. We've heard it, urbanization presents, of course, challenges, opportunities. It's a reality we have to confront head on, whether you like it or not. It is basically influencing the way we think about health, about housing, the way basically all our societies are developing. It's more than just a demographic trend. We often, mention the fact that more than half of the world population will live in urban areas, but it's more than that. It's a very complex phenomenon that demands thoughtful consideration, particularly in relation to how we design and also implement policies that promote the health and well-being of urban population. And in all this, local governments play a pivotal role. And I was very pleased to hear that, you've been kind of, scaling up your work with local governments, because as we know, a lot of things start at the local level. Policies, decision taken by local governments, the services that they offer basically directly impact on many determinants of health, such as mobility, housing, water sanitation, food systems as well, waste management, education, and so on. So the influence that local government holds over these areas is vast. Sometimes it's a little bit blurry, and it's difficult, to know where to start because it's so vast. But it is critical to involve them in international policy making, which is precisely our mission here at the Global Cities Hub. I have to be honest with you, progress has been made on that, but much work remains to be done to truly integrate local and regional governments into international policy making. States have come to realize that they cannot tackle all of the global challenges on their own, and that a whole of government approach is necessary. This has started somehow to be acknowledged in the field of SDGs, the Sustainable Development Goals, where there's more and more, recognition that we need to localize these SDGs. And for that, of course, as you know, local governments are essential players to make this localization happen. And at the Global Cities Hub, we're very much committed to connecting, again, local and regional governments to the work of international organizations to basically foster that localization of SDGs. So today's workshop will discuss the gaps in existing tools and intervention related to urban development and health. And we also will explore potential future directions for collaboration at UN Habitat and WHO. And this includes hopefully reviewing through an urban lens the standards on health and housing that guide the work of both this international organization. We are very pleased to host this workshop, pleased to provide the opportunity to local and regional governments online to engage in this discussion from the outset and contributing to shaping, future-oriented policies in the area of urban health. So after the presentation of the expert, we'll have a Q&A session, if time permits. So feel free to please comment, ask questions on the Zoom chat that our colleague Simone is handling for this event. I'm now pleased to hand over the floor to Dr. Nick Banat-Valla, sorry. You're the head of the Secretariat of the UN Interagency Task Force on Non-Communicable Disease, and you will guide us through the discussion. So thanks again for being here today, and I look forward to a very insightful conversation. Thank you.
Great, thanks very much, and it's a pleasure to be here. And it's amazing for a meeting that's being run by UN agencies to start on time and to be on time. So lots of congratulations to everybody. Look, there are quite a lot of people online, so it's just impractical, obviously, to introduce ourselves. But I think, Laura, you did start the game by saying, look, here I am. So let's everybody introduce themselves online so we know who's there, and people who've got computers can just put their names on there and say who they are and how to here and all that sort of stuff. Now, this session is around strengthening public health in urban settings, building on UN Habitat and the WHO partnership. It's a 30-minute session. And of course, most of you will be aware that there is this memorandum of understanding that exists between WHO and UN Habitat. And so it seems a good place to take stock of that. The partnership started when Natalie did, not the partnership, the MOU, and it finishes in September 2026. But when did they actually get signed off? Do you know?
So the current one in 2021.
Yeah. 2021, okay, 21 to 2026. And so it's a good opportunity to kind of review that, see what it says, see what lessons we have learned, because that will help us move forward. So I've got a few thoughts, but I want to hear first from Natalie, because you're going to introduce this and speak on behalf of yourself and Graham, who's had to pop out for a moment, which is why I've got an empty place here. And then he'll join us later. And if we've made all sorts of decisions before Graham comes back, well, such is life. But Natalie, over to you.
Thank you very much, Nick. So we have 50 minutes, okay? Let's sort everything. No, thank you very much, Nick. And as for this the next couple of minutes, we really wanted to give you a little bit of an update of the work that has been achieved so far. And I think I need to give a disclaimer. These are just some examples, because obviously there is a lot of work that has been done previous to the MOU signature, but also during the current MOU implementation. So as regards to time, I cannot present everything. So we wanted really to give you some snapshots, but also give you some different ideas of the type of work that has been done. So maybe just to start, and if I could have the first slide. So I'll just keep talking, and then hopefully at some point the slide will show up. First of all, is just to say that although the current memorandum of understanding that Nick was referring to was signed in 2021, it goes without saying that the collaboration between the two organizations has, a long-standing history. Not only a long-standing history because of collaboration, but that actually there has been a memorandum of understanding signed even before. So the current memorandum of understanding actually builds on an older memorandum of understanding. And so if you go back actually and you look at the work since 1992, just to have some kind of a starting point, WHO and UN Habitat have been collaborating in a large number of different pieces of work. And one example is the panel of environmental experts on the management of vector-borne diseases, which actually is a partnership between FAO, UNEP, and WHO. And UN Habitat joined that partnership. So again, this is a very clear example of, first of all, one very specific area of work, vector-borne diseases, but a collaboration that really was building on a joint number of UN agencies, right, of joining forces. The other example is that actually, very practically, UN Habitat seconded a staff member to WHO, to the Environment and Health Department a couple of years back, in 2012, actually to have specific work done on the development of monitoring mechanisms for SDG 6, so on water. So there was this formal collaboration, not only to have, some loose, if I could say, agreements of collaboration, but actually UN Habitat seconding one of its staff members to WHO. Another example, and this relates obviously Nick's role here, is that UN Habitat is one of the founding members of the Interagency Task Force on NCDs, making sure that when we look at health-related issues and NCDs in particular, UN Habitat obviously is a key role to play. Another example are the housing and health guidelines that you see here on this slide. The housing and health guidelines were a WHO publication, so it's a WHO, product. However, UN Habitat obviously played a crucial role in its development. Certainly, this is also a little bit at the start of the discussions today, right? Where to go also with these guidelines. And then just to close, it was two different examples, very local level. WHO implemented the Urban Health Initiative on air pollution in cities in two countries, in Ghana and Nepal, so Accra and Kathmandu, where we were looking at air pollution reduction and climate change mitigation. And actually, UN Habitat was one of the key partners on the ground. So to give you an example that when we talk about collaboration, we are not only talking about collaboration at the very global level, right? We are talking actually at collaboration at the very local level, at the very country level. And another example would be the monitoring of water quality in humanitarian settings, where collaboration took place in Bangladesh. So this is to kick us off with the discussions. And as I was saying, if we could move to the next slide, in 2021, there was somehow the recognition of building on the previous memorandum of understanding and, shaping it further. And I think that in difference to the previous one, not only we identified specific themes, thematic themes, actually beyond what had been originally done, but actually I think we also identified the need to address joint strategic cross-cutting themes. So it was not only about, addressing urban and territorial planning, which is one of the priority areas, or communicable diseases and injury prevention, or urban environmental health and basic services, so water and sanitation, emergency preparedness and response, urban health and migration, vector-borne diseases, safe and healthy housing, and safer, healthy diet in cities. So it was not only about, working on those priority areas, but it was also to identify mechanisms, right, that were needed to actually better implement those priority areas. And there was a strong alignment between the two organizations that if we want to be successful in addressing those thematic themes, we need to make sure that there is policy and strategy alignment between the two organizations, that we need to make sure that we have a harmonized approach as regards to disaggregated data development, that we need also to have joint research and innovation, right, approaches to urban health, that we need also to develop, joint positioning in order to have common and joint messages. It doesn't help countries, right, if two organizations working on a topic that is, one and the same come with different messages. And also to jointly identify capacity development gaps, but also to make sure that there are programmatic and project linkages across the three levels of the organizations. And although UN Habitat and WHO might be organized slightly in different ways as regards how the regional offices, are organized, as regards to country offices, there was a real need to make sure that a memorandum of understanding was not just a collaboration between UN Habitat headquarters and WHO headquarters, but that it has a strong involvement of the regions and the countries. So I think this was a real shift, and this is what this new memorandum of understanding highlighted. If we could move to the next slide. I will now just share some examples. And again, I'm really underlining that these are just some examples of the work that was implemented in the last couple of years since the signature of the new memorandum of understanding. And so if we look at urban and territorial planning, there was a number of publications that have been achieved. First of all, there was a source book that was jointly developed on integrating health in urban and territorial planning, because there was the understanding that urban and territorial planning is actually the public health measure, if I could say, right? And that we need to make sure that health is seen as the entry point, but also as the outcome of any urban and territorial planning exercise. So a number of products were developed. In the area of non-communicable diseases management and prevention, there was a very active participation of UN Habitat within the United Nations Task Force meeting. There was joint briefings, joint missions were implemented on urban environmental health and basic services. Obviously, there was a strong collaboration in the further establishment of the UN system-wide monitoring mechanisms for SDG 6, where WHO is also a custodian, right, co-custodian of SD 6.3.1. In this regard, we can also mention air quality, right, where WHO actually is the custodian agency for PM 2.5. In the area of emergency preparedness and response, obviously, right, as a follow-up to COVID, there was a clear recognition that we needed to look at the role of cities in emergency preparedness and response, and a strong collaboration took place. And last but not least, again, just to mention some few examples, in the area of the management of vector-borne diseases, there have been a large number of collaborations, including the development of a joint global framework for the response to malaria in urban areas. And I think this is just to mention what Graham highlighted in the beginning, that very often we are now shifting towards looking at the increase of non-communicable diseases, in urban environments, because this is one of the key challenges that we are facing. But in urban context, we are facing more and more also the coexistence, right, of the risk of communicable and non-communicable diseases. So this is the importance of having this joint approach to urban health. If we can move to the next slide, it's just to show you what I've just said under a slight different, view. It's just to say that joint efforts have really been made to shape global agendas. So yes, there are some tools that I've just presented, right, that have been developed, but this joint agenda also relies on the development of a number of different other things, including, strong collaboration at the very senior level. You see here a picture of DG Tedros and Executive Director UN Habitat. You see examples of the collaboration and the inclusion of health within the World Urban Forum, where actually health has been, given quite a lot of space, not only with high-level representation, but there were quite a number of events jointly organized where health was put in the core of the agenda. And then you see here also specific other documents, like a directory that was jointly published by WHO and UN Habitat, summarizing all the different types of resources that do exist worldwide, actually, not only led by WHO and UN Habitat, but there are many partners who actually are in the room here and online that are actually helpful to address urban health, in urban and territorial planning. If we go to the next slide, this is again to show that the effort was to move from only global to global, regional, and local. And so here you see a very specific example of joint work at the very regional level, where a Pan-African action plan for active mobility was developed. And you see that this is really an effort, again, building on global normative guidance developed by WHO, strategies developed by UN Habitat and others, but taken down at the very regional level to identify and actually to respond to the very regional needs. And UN Habitat has actually been closely collaborating with WHO Eastern Mediterranean Healthy Cities Network. You remember in my opening remarks, I was saying that we have strong regional healthy city networks, and UN Habitat is a very strong partner for the development and the implementation of that network, including in the development of key indicators, criteria that do define healthy cities. And here we have an example for the regional work. And if we can move then to the next one, and I'm slowly coming to an end, this is really to take you down to the very local level. So we have a joint project that is called the Young Game Changers Initiative, which really aims at improving health and well-being of young people in intermediary cities in Senegal, Colombia, and India. It is a very participatory approach, so it does involve young adolescents in the process of shaping and rebuilding public spaces. And obviously, health is a key, or has to be a key outcome of that process. So this UN Habitat and project has different components, and the health part is co-led by WHO, right? Bringing in the expertise, implementing and developing tools that are actually necessary for making sure that health is taken into the considerations of any urban planning measure for shaping public spaces. So this is one very concrete country project, and the Urban Health Initiative that I mentioned early on is another one, right, where really concrete work was done on the ground. So if we can move to the last slide, a lot of lessons learned, a lot of achievements made, right? But obviously, as Antu, you were saying this, a lot more to be done. And so we need to know what more needs to be done. How can we do it differently? How can we do it better? And maybe I would like just to pause on two reflections and two lessons learned so far. The very first one is that obviously WHO and UN Habitat are operating with very different constituencies. And those different constituencies require strategic alignment, right? And so we need to make sure that we build and make best use of those different constituencies but we also explore the mechanisms that are needed to bring those constituencies better together. And this is not only requiring coherent messaging, but also needs to build on stronger strategic joint engagement mechanisms, right? That will result, pardon me, in greater impact. The second thing, and I think this is really crucial, is that informality is crucial for sustainable urban development in promoting urban health. Urban health is actually urban health equity. If we talk about achieving urban health, we need to frame it as achieving urban health equity. And urban development and related health outcomes are particularly important in informal settlements, in low-income settlements, and therefore we need to explore how we can address informality as a key entry point to reducing social, economic, and environmental inequalities. So these are just some reflections, right, that just to kickstart some of the discussions, but also some of the observations that we have done collectively between WHO and UN Habitat. So really one big question for us is what additional key considerations we should be prioritizing to ensure the collaboration in a way that it's more efficient, more compelling to challenges, to maximize urban health. And to conclude, to pick one of the topics that was mentioned at the very beginning, and I would like to close with this, is that obviously among the variety of topics, the topic of housing definitely is one of, important topic. And so we would like to hear more about your thoughts and new ideas and comments, and also maybe criticism, right, of what has been done so far. So thank you very much. So we have a couple of minutes to decide before Graham comes back. Anything you want to do before, please?
So thanks very much for setting that out. Thanks to Laura for putting on the chat the MOU link. So please do open that and have a look at that. It's going to be perhaps a bit tricky sometimes to see who's putting their hand up on the screen. So also please, those of you online, do also put your note on the message in the web chat if you want to speak, so that we can include you. But if you've just got simply a simple comment, like agree or something, then do use the whatever emojis and the comments as required. And let's try and make this as interactive as possible. I know it's a real challenge when you've got a group around the table, but they don't seem like a very intimidating group. They seem quite a nice group here. So we've got this MOU. I'm mindful that this ends in September 2026. So I'm thinking to myself two things. What are the plans for taking things forward between now and then? And I'm thinking about activities, but I'm also thinking under the assumption that there's been this collaboration for a long time, I guess there will be a lot of interest in developing a successor to this MOU. So when would that start? What would that look like? What would be the lessons learned? Would there be a sort of, I want to call it a full review, but an assessment and building on what you've just presented? I'm also mindful of two other things, which I think we have to keep in mind. One is the current global health and development financing position at the moment. And we don't want to go down this rabbit hole of despondency and despair, but we just need to be aware of that. And agencies are going to be asked to focus ever more on their core business. So with that in mind, I did take a quick look at the WHO global program of work, general program of work, and it does talk about urban settings and urban work, and it does highlight the importance of SDG indicator 11.11, which I don't know offhand, so I will read: proportion of urban populations living in slums, informal settlements, and inadequate housing. And that's under the broader strategic objective, the WHO, of addressing health determinants and the root causes of ill health. So there's clearly an entry point there. I'm also aware that UN Habitat is developing its strategic plan, which will be going to the UN Habitat later this month. And so I'm thinking to myself, well, how is health going to be reflected in there? That was not a Freudian slip. How is health going to be neglected? I don't believe it is as strongly reflected as it could be in there. That is something which the governing body is going to have to assess, and maybe we may want to highlight that even at this late stage, but that's something for us to think about. So with that, let's see who is up for reflecting on what Natalie has said or any other introductory comments around this agenda. So who's going to go first? Please do.
Can I speak again?
You can speak again.
Just to bounce back on one of the comments that you made, that UN Habitat and WHO have to work with very different constituencies, where, you know, WHO is of course guided by member states and UN Habitat as well, but it also has this you know, habit to working a little bit more with local government, given, you know, its mandate. So my question is, to what extent, you've mentioned a lot of different, you know, examples, programs. On the ground, it seems that you're working pretty, you know, like consistently with local governments when it comes to, you know, like improving health on the ground. But how is it at policy level, basically? How do you make sure that you listen to the needs and the demands of local and regional governments when it comes to urban health and well-being? How do you include them, you know, early on in the process of basically designing your policies and program? And sorry, it's a very biased question, but of course we're driven by our mandate at the Global Cities Hub. Thank you.
Okay, so what we'll do is let's collect a few comments and thoughts, and then we'll come back in. And I don't want Natalie necessarily to feel she's in the firing line. She's it's for all of us to respond to many of these issues. Now, Christelle, I think that you as the Programme Manager Officer for UN Habitat Online, do you want to say a few words?
Can you hear me?
Yes.
Oh, okay. Sorry, I was not able to talk. Hi, everyone. I'm not sure if you can see me, but I think you can hear me, so that's good, I guess. No, I think adding to what Natalie was saying, one thing to also flag is that we also come together with different UN agencies to also produce other types of work, like together with UNICEF. I don't know, Natalie, if you mentioned it or I missed it, but we're also working on the urban health for children. So not only as us together as UN agency, but also with other UN agencies together. Just maybe to flag, I don't know if that's the moment, but things to reflect on based on what we have already done in the MOU and things to consider in the future. I think after COVID, well, COVID was kind of a shaky moment for us, and the priorities were shifted for that. And so in the MOU, we focused a lot on the COVID response and the urban and territorial planning. And more recently, now we're picking up the housing discussion and the non-communicable diseases focus. I think one thing that's kind of missing with the new trends that we're seeing is the climate and health nexus. It is there in the MOU, but it's not flagged as like an important standalone thematic in the MOU, which I feel could be something to explore. The mental health and well-being is something that's not very highlighted, but we're seeing at the local level, especially with the program that Natalie mentioned on the Young Game Changer Initiative, the really like the role of like providing livelihood opportunities in cities that can enhance the well-being and the mental health of population, but also after disasters and conflicts, maybe we haven't touched upon it quite yet, and also for aging communities with the loneliness and the homelessness as well. Also driven by the outcomes from our local implementation, there's a lot of focus that could be maybe put on the digital transformation and focusing on maybe AI and maybe big data, especially at the local level. We're struggling to get some health data on the local level. We always get it at the national level more easy. So maybe we should think of how we can collaborate, be more innovative in gathering such data at the local level. And finally, I think on the participation and governance, I mean, it's also important to acknowledge or maybe have somewhere in the MOU that we do promote this participatory planning from the local level with maybe young people, grassroots organizations, not only the local government, but the many different stakeholders, and how can we support government to enhance their participation at the local level. The last thing, I know that there was a point on the diet in the MOU, but maybe we could expand it to more like planetary health and food system, linking to the One Health initiative. We are not part of it as a Habitat, but that could be something to explore I think finally, yeah, someone touched upon, you know, WHO is great at the national level. We have this connection at the local level, but I think this is very positive, and I see it very like working when we're talking about this like multi-level governance, especially when localizing SDG. So I think we should keep in mind the assets of both organizations in order to drive localization further. So these are my comments. Sorry if I'm being very fast. I hope you heard most of it. Thank you.
That's really helpful, and that's very clear. And I can see that the little chat online seems to be picking up everything you say, so clearly not too fast. So that's good. Now, Sheila Patel, you put some comments in the chat. You may want to speak to those a little bit. And then I see that Johnny Handley put in a comment about small island developing or Pacific small island states. And so it'd be interesting to know a little bit as to the reason for you asking the question about receiving information on collaborative work between the two organizations in these settings. So, and then Andres.
Yes, if I may, I would like to make a brief comment because also food was mentioned in the previous intervention. And we appreciate a lot the fact that there is a cooperation between UN Habitat and WHO. And when we are talking about the local level, it sounds obvious that for the mayor, health and housing and food security are all issues on the table. But at the national level, at WHO, you have health ministers. At UN Habitat, they have ministers of development or infrastructure or administration. When we are talking about food security, might be the Minister of Agriculture. Could you give us any insight if you saw kind of collaboration at the national level between the different silos?
Okay, thanks. Are you okay, Natalie, at the moment in terms of?
I'm fine. I'm following.
Following and
good.
And also, please remember that it doesn't have to just be Natalie that has to respond to these. Others can respond as well. Let's go to Sheila, please. Oh, so now Sheila says my mic has been turned off by you, not by me, but by somebody.
Can I? Have you given me the floor?
Yes.
Okay. So I just wanted to say that we are working on a campaign where we are doing 100 learning labs with community women's collectives in 20 countries, of which we've already finished 10. And we're looking at extreme weather and informal habitat structures and what can be done to improve that resilience and its impact on health. So extreme heat and extreme water like rains and flooding and its impact on people's lives. So we're doing this. We've already worked for the last 2 years. We've published 2 books. And if there's any way by which we can participate in contributing to what you're doing, we'd be very happy. We find that most of the attempts of UN Habitat and WHO focused on local authorities do not in any way come into the lives of those who live informally. In fact, more and more households are facing evictions. So I think we have to do a reality check on how a lot of investment has to be made in preparing resilience strategies for the communities themselves, because we have not in the last 20 years been able to address this really sticky problem of informality that is now 3 generations. And I think UN Habitat has to really strategize to work on both ends. So I'm just stopping there, but we are doing a lot of stuff and we are happy to share everything that we're doing. But health and extreme weather and habitat connections I see, and I see that as very important in what you're doing. So we're very happy to collaborate and share what we do. Back to you.
Thanks very much indeed. And Sheila, if I'm right, you are with or were with Slum Dwellers International. Is that right?
Yes, yes.
Now, everyone probably knows that, so you didn't need to introduce yourself, but there may be the odd person that doesn't know people that are speaking. So I'd encourage people to just introduce themselves when they start. And I think we've got a couple of other people now lined up. We've got Tiago, who's going to speak. Tiago, Eric, who's going to speak, and then Johnny will come in.
Thank you, Nick, colleagues. Tiago Eric de Sá. I'm with WHO headquarters. I'm the responsible officer for age-friendly environments. That includes the coordination of WHO's global network for age-friendly cities and communities. I just wanted to give two comments. And I was very pleased and privileged to have been part of a lot of the initiatives that have been mentioned before, so very much engaged and willing to continue collaborating on the collaboration between WHO and UN Habitat. Looking back at the MOU we currently have, I miss perhaps us elaborating more on the enablers. So we have the themes, and we could always expand on the list of themes. They're all relevant. But how do these two organizations believe that we can enable urban transformation that is conducive for urban health? So how do we help cities and communities to unlock finance? How do we enable communities to meaningfully engage people in transforming their realities? And again, I think we have a lot of examples to show and share on these different enablers. Natalie has just mentioned the young game changers. It's a good example. The very much framework for age-friendly cities and communities from WHO depart from the meaningful engagement of people in deciding what is relevant and which actions should be put in place to make a city more age-friendly. So I really miss us elaborating more and making explicit the enablers and then the actions that both organizations would put in place to fulfill those enablers. And then a second quick comment, just reacting to the comment made on WHO engaging mainly with member states and UN Habitat with local authorities. It is mostly the case, but also mainly through our city networks. WHO has a couple of them. Age-friendly cities and communities is one, of course, the Healthy Cities, Partnership for Healthy Cities. We do engage a lot directly with local authorities as well, and we partner with UN Habitat on those. And I think that through those city platforms that we have, we can also ensure, and then we do that on a regular basis, and ensure that they're also active and engaged in defining policy, both at national and global levels. Thank you, Nick.
Okay, thanks very much. Look, we're just a couple of minutes over time, but we're the UN, so we can do that. I think we'll indulge ourselves by keeping this going just a little bit longer. Johnny, you had some question, or you had a question. Are you there, Johnny? All right, well, maybe you will. Come on. Now, who else would like to ask a question? I can't believe that I'm sitting in this room and my colleague Fiona has not wanted to speak. This must be a first. So break that first by speaking.
Well, thank you, Nick. Very good afternoon to everyone. Fiona Ball from WHO headquarters. Lead on physical activity with a focus perhaps of relevance to this audience and discussion on walking and cycling being key modes of sustainable transport as well as enjoyable active recreation, and both can be beneficial for health. Nonetheless, the environments that we invite people and encourage people to walk and cycling are not safe enough and not conducive, and largely, with few exceptions, although there are well-known exceptions, levels of walking and cycling could be increased dramatically for the gain that would bring and the livability of cities. So I'm here and interested in the direction of the next 18 months, as you point out, Nick, to what is going on now, what can happen in this window between re-signing, but also contributing to the discussion about what could be put into the next MOU that could strengthen. I did note and stand to be corrected, but the themes did not include sustainable transport, Perhaps that was implied maybe when it had injury prevention attached to NCDs. I'd encourage those to be separated, and I'd encourage, in fact, far stronger thematic focus. And picking up on Thiago, what will enable the cities to deliver communities that can walk and cycle by choice and when needed safely. I'm proud, and you've given me the opportunity, so I'm going to take it. On Monday, WHO will be launching the policy options. Thank you very much. The policy options. So we do know what to do, and it aligns with lots of the work that you've done, and many of your work will have contributed to it. We have to help support and strengthen the capacities of cities and to implement these well-known safe environment urban communities, as Graham's walked back in said. We're building the communities of the future. What worries me is we are not focusing on walking and cycling, and that costs money, it costs lives, and it costs health.
Okay, thank you very much indeed, Fiona. Let's go straight to Johnny, who I think is now unmuted. Wow, misinformation or disinformation? Johnny, one more time. Okay, Graham, welcome back. It's all signed, sealed, and delivered for the next 5 years.
It's all good.
It's all good. That's right.
Okay, I'm sorry.
So, any other comments? Last comments around the room or online? Yes, I've got one from Ji Zhang, if I'm pronouncing that correctly. Oh.
Yes, thank you. Hello, everyone. My name is Zhang Chi. I'm a professor from Beijing Institute of Technology, and I also work for the Lancet Countdown, which is an organization that we provide systematically climate change impact on population health worldwide through a robust indicator framework, and published already 9 annual reports to date. So from our research, we find out that urbanization urban health would be a very key issue in the following days. For example, in the COP29, they have the WHO initiated the Health Day in COP28, but in COP29, after the Health Day by WHO, they also has the Urbanization Day. So from what we have found so far, that not only WHO, but also WMO, UNICEF, ILO, and many other UN organizations, and also UN Habitat has noticed that at this circumstances, we need to have this kind of adaptation measures at the city level and at the local level and even at the community level. So what we also have done so far is that we provide those kind of findings of the case studies based on the adaptation measures proposed at the community levels worldwide. And for example, in Dhaka, in Mekong River, in Asia and Western Pacific area. So they all have very good pilots so far at the community level and the city level to help those kind of citizenship and those vulnerable groups to better adapt to this kind of risks posed by not only for the climate change, but also for their health risks. So I would like to see that also I want to give some feedback about the reflections, what the host has said before, that we need to in the future, we need to hold this kind of multi-stakeholder collaborations worldwide, not only at the UN level and the regional level and governmental level, but also to include those kind of industrial level collaborations, municipal level collaborations, and research levels, of course, collaborations all together to provide those kind of top-down and also bottom-up strategies from the both sides, and to realize the possible adaptation measures for the urban health in the future. And I would like to, we would like to share what we have done so far with the evidence-based studies and also the case studies we collect worldwide for the possible pilots for the future adaptation measures so far. Yeah, thank you.
Okay, thanks very much indeed. So let's now try and respond to some of the comments. And of course, I think no one would expect Natalie or anyone else to be able to respond to all of them. They're all on the chat and they can all be reflected on in due course. So Natalie, it'd be good to hear from you. And then I think it would also be good to hear from you and Habitat. Now, Graham, you've only just come in, so you might hear some comments from Natalie that you can respond to, but there may be others, whether it's Christelle or colleagues around the table, that might want to add one or two things in. We're now at, well, I don't know if we could finish this in the next 10 minutes or so, but I think it's worth us spending a bit of time on this because it's so important. The point is gathering together and not spending the time. So Natalie, over to you first.
Thank you very much, Nick, and thanks a lot for all these incredibly valuable comments. And as you were saying, I'm just gonna reflect on some of them. The first one, which I think is important, is about the constituencies, right? And Tiago did mention a couple of comments on this. Indeed, we have different constituencies, and this is the case. However, we have been seeing how we can build actually on the city networks that Tiago has mentioned, and how they have been actually influencing in supporting the shaping of decisions also at the regional scale. So if you have a city network, the Healthy City Network of the European region, of the Eastern Mediterranean, they actually play a key role in the discussions with the regional committees. So although the constituencies, right, on paper are very different, the city networks actually do play a key role in shaping the agenda. The second one is that, as an example, just a couple of weeks back, the second global conference on air pollution took place in Colombia. And if you see there, actually, countries, but not only countries, actually cities were also called upon to do pledges as regards to addressing air pollution and reducing air pollution levels. So it's somehow an indirect way, you know, of bringing in the cities into the global discourse, because you're putting them not only, you know, as the beneficiaries, but also as those that will actually call upon themselves, but also member states to support the action. So this is just one entry point to the question. The second thing that I wanted to reflect upon, which is somehow related, is about the fact that, yes, WHO's counterparts are ministries of health, right? But actually, if we want to look at urban health, we need to make sure that we have other sectors being at the table. And we have examples to look at. If you look at environment and health, you have the example of, again, the European region, but also the African region, where you have regular ministerial conferences that are co-led or, you know, co-attended by ministries of environment and ministries of health, or the same is for road safety, right? And where you have actually representatives not only from health, but also the transport sector. So we have examples in-house, if I could like to say, where WHO, in collaboration with other partners, right, has brought together representatives at a very high level of the government, you know, of different sectors and making this work. The other thing that I wanted to reflect upon is about the enablers, because I think this is extremely important. And I would like to give just another example of what should be, at least my opinion, an enabler. It's about strengthening capacities. Because actually, if we want to make sure that things change, if we want to make sure that collaboration increases between the different sectors, at the national, but at the local level more importantly, we need to build capacity of those actually that are implementing the policies to collaborate with each other. And so, and this is a way we're then going to have joint financing, right? So one of the key enablers is to strengthen capacities, strengthen implementation mechanisms to be implemented jointly by the different sectors. Just one or two additional points, and then maybe handing over to colleagues. We haven't heard about many topics that have been identified as missed, right, by the MOU, and I think they are very well, the comments are very well taken. Maybe just on the climate change, I wanted to reflect, because indeed, maybe it's there and not sufficiently there, but I would like to say that the climate change is definitely one of the areas where collaboration has been actually happening. Maybe it's not visible, right, in the MOU, and I think it should be addressed. because climate change is one of the key areas, right? To look at even in our global program of work, climate change is one of the key priorities to be addressed. But just to say that there is a long-standing collaboration, also in preparation to the COP, but also to the last and upcoming World Urban Forum. So I just wanted to put on that. And I would like to say maybe my last comment is to reflect on Sheila's comments, because it's a real pleasure to see the connection being done here through this workshop. Absolutely. I think that the importance of working at the very community level, trying to identify key resilience, mechanisms, making sure that all this is done with a very strong community and participatory approach. This is one of the success. I mean, we need to build it if we want to be successful. So these are just some examples. I didn't reflect on everything, but at least this was my first takeaways from the discussions.
Great, thanks very much indeed. So let's hand over to UN Habitat for a comment. Graham, do you want to feel in a position to say something and then pass on to relevant colleagues?
Very much so. Like in all food meetings like this, we always pre-cook what we're going to say before we go, so it's not so bad. It isn't radical departure, what I'm going to say. I mean, I think, yeah, for me, I know I wasn't here, but I can guess what the things that came up in discussion. Different constituencies, yes, I agree with Natalie, yes, but the same messages. And this is the biggest, most important thing. The messages that go to national governments need to be the same, the cities follow everything else. So yes, we do work with all of us, I mean, Ministry of Health, we work with the Ministry of Local Authorities, in Brazil it's the Ministry of Cities, we work with the line ministries as well. So, but the messages must be consistent. One area which I feel, I'm sure you'll all agree, the area of mental health and its relation to urbanisation has not been adequately considered. And in fact, many of the social determinants linked to that are a big gap in the collaboration that we've had so far. We need to work on that. The other thing that I think we need to consider is that the impact of AI, machine learning, and artificial intelligence and other things in general, that this is going to have such a quick an impact on what we do on health. And it's not going to be 5 or 10 years' time. It's going to be next year or next month, because we're already seeing AI being used, in lots of diagnosis now. We're learning that AI is useful, in diagnosis of particular conditions. But we can use AI in other ways. We can use many of these things to help us design and influence urban space. So there's going to be a whole range of things which go beyond everything we do at the moment. I think the issue of SDG localization is very important, because as we move forward to the successor of the SDGs, we as Habitat hope we're going to see much more about urban across whatever the future monitoring is. But we mustn't forget that the biggest problem with the SDGs is their national statistics, and they don't reflect the intra-country differences. And in many cases, if you go to the African continent, many of our colleagues still think that Africa is a rural continent. It's actually not the case. So, you've got policies at national level, you've got statistics at national level, which are not reflecting what's happening in urban centres. And then my final point is on line ministries. Historically in the UN, we've been a little bit sort of, not so good at sticking to our line ministry. WHO, Ministry of Health. Habitat is always the Ministry of Local Authorities or local government. And one of the reasons we've done that is because we have an impact on, if you like, the regulated. So health, international health policy, by WHO. For us, urban planning and design. But we've got to go past the regulation. We've got to, in particular, I feel, and this is very much on Habitat's mandate, is we've got to influence the built environment professionals much more. We are not doing enough to reach out to urban planners, but go much more beyond that, the people who are building our cities. And it's without these changes to the physical and the social environment. It's not just about physical buildings, by the way, it's also about governance systems. We have to much better understand how at the city level governance works. Because if we want the community engagement, we rely on the local authority, the city authority, the elected officials, who are the ones serving the communities who we're aiming at. So, you know, it's no good. It's no good of us legislating at national level. You can't legislate on how communities work, and that it doesn't work. You have to use the innovation and the spirit from elected and unelected leaders who are champions. And that's why we all work, try and find champions to work with, because we know that's going to have a big impact on the ground. So for me, it's all about, and this goes back again to something we've always talked about, but it's empowering those in the urban setting that they have the responsibility to bring change. Everyone will always say, oh, it's the Ministry of Health, it's a health issue, but it's not. We have to get through to the built environment professionals, in particular to the planners and those who are responsible for the network of communities and social services. We have to get through to them, that they have a responsibility to deliver health goals. So that means whatever comes after the SDGs has to address not just what the Ministry of Health does, it has to go much deeper than that. So I'll stop there anyway, because I'm sure there's many other people.
Let me just build on that a little bit. In one of the multi-sector working groups, the UN Habitat Retro collaboration, I had a great discussion with somebody who was working on housing and tuberculosis. I was talking about how important it was to have houses screened and as the opening to be as small as possible to prevent mosquitoes from getting into things. Now you need to have them much bigger so that you have airflow. And I don't know where those conversations happen to influence the people who are working on the built environment. And I don't know if those are happening at all, or if I produce a malaria document and then put out through another document, and then people who are doing the work have to read both documents and figure out what the answer is. I don't know.
Can I maybe say something on that? I mean, you know, one of the, if you like, the third subtitle of this meeting is how we revisit the housing and health issue, because as you know, guidelines were produced by WHO some 5-6 years ago now. But we also know that in that housing and health guideline, there was nothing on vector-borne diseases, there was nothing on social and mental health. So we hope that these things, because those are the things that we want to put into the new guidelines, we want more useful operational guidance that people at the local level can embrace and build into their policies. If you want to build if you're a building officer in a city and you need to modify your building code to deal with climate-induced disease, you need some starting point. And it can't just talk about policy, it has to give you some hard guidance on how many air changes you need or what have you. So I think we hope that in the future, when we move towards this, we've been mandated, our two heads of agency have agreed that they're going to work on new housing and health guidelines, which are more operational. And I think this is very much one of the things we're aiming at.
Yep, okay.
I know we are very, very quick, but just when we developed the housing guidelines, 2018, they were launched, we wanted to have the architects part of the discussion. So we actually reached out to the International Federation of Architects and to have them, you know, as one of the developing partners. It was impossible. Yes. So I think that it's changing, right? But it's what we were saying before about the enablers, right? Because it's not, you need to make sure that there is a recognition of the role that they can play. So yes, they need to be at the table, because otherwise you have the health part, but you need to make sure that whatever the way that it's built, right, takes into account those health considerations. So this is just to say that it's not always super easy, right? And that's why we are.
Okay, that's great. Now, I do note that at the end of the day, we've got what's called next steps and closing remarks, again from Natalie and Graham. My question for both of you is, will you be reflecting on what the next steps are with regard to the MOU and the collaboration, going back to the fact that this now ends at the end of September, so therefore there will need to be, understandably, some ongoing prioritizing and the development of a new one, or whether it's wait and see. But I think that people want to know a little bit on those two key issues. You can either do that now, or you can have a bit of time to digest it and then come back to it. I think you want to do that, so that's fine. But please do come back to that. So at this stage, I'm going to say thanks very much. Apologies for overrunning by a bit. I think it was important to get this in. Back to you.
Thank you very much, Nick. And thank you for all the first round of comments and questions. I think it was an animated start, and it brings us to our second session with a great line of speakers who will speak more about where to go from now, what are the issues we have to reflect in the future. And we will have a framing presentation from Professor Mark Nieuwenhuizen from IS Global, and then a great line of speakers, Professor Jason Corburn, it's Kobe Brandt, Professor Joe Ivy Wooford, Dr. Ellen J.K. Mina, Dr. Blessing Emberu, and Dr. Annelies Wilder-Smith. But before I give the floor to Mark, I would like to invite all of you to join us for a poll and to join the Mentimeter. And while Mark is doing his presentation, you have the chance to answer this first question. What do you see as the most pressing public health challenge linked to housing condition? You can see the QR codes on the screen, and we will also put the number code in the chat for those joining online. For those in the room, you have the QR code here. And without further ado, I would like to invite you, Mark, to give your presentation. Mark is the Director of the Urban Planning, Environment and Health Initiative at IS Global, and the world-leading expert in environmental exposure assessment, epidemiology, and health risk impact assessment, with a strong focus on interest on healthy urban living. So the floor is yours. Please set the scene for us for the next stage.
Thank you so much, Geneva. Hope you can hear me.
Perfectly.
Okay, thanks so much. Very happy to see this meeting and the coming together or the being together of UN Habitat and WHO. I think it's extremely important. I was asked to give a brief presentation of some of the issues what I thought may be important. So I give a short presentation, bring up some issues, and then I'm sure other speakers will also talk about some or bring up what I've talked about. Now, I must say that I've heard quite a bit already for what I'm going to talk about, so that's very encouraging as well. That I don't have to tell you that we have many problems in our cities. Many people go to cities, there are problems, but there are also greater cities. And I think also many of the solutions are actually in cities. And this is, you know, that you need to have the local context. I think where some of you have talked about as well, that you can't do on national level, but you need to go to the local context to see what are the issues and what are the solutions there. That we're also very much aware that cities are a very complex system, many things going on at the same time, and we're trying to address many of them, but of course it's kind of limited what we could address. But at the same time, we know that many things are going together at the same time. There are also many players, there are many issues, there are many whatever you can think of. And this is a slide from Giles Scotty, from Billy, I mean, that we put together for a paper to bring out some of these issues. What is important from here, the discussion, I think, is many drivers that are in the in urban planning, in housing, in transport planning that affect health a lot, have a significant impact, and therefore are very important to address. And that's why it's also very important to work together. As what you heard before, I mean, you've been working on air pollution before. I want to emphasize again, air pollution is still very much a big problem, particularly also in cities. And I encourage you to continue working on this, particularly in cities. What we can see, they have, you know, there are hotspots of air pollution because the high density of different sources. I mean, whether it comes from the residential heating and cooking, or from transport, or industries that's still in or around cities, we still have a big problem there. So we need to continue to reduce air pollution. One of the main drivers of the air pollution is actually the use of fossil fuels. It continues to be a problem. And we know that many deaths and a number of cases of diseases are related to fossil fuel related air pollution. So we need to keep this in mind. The other thing, what we know about fossil fuel is that it's also driving another big problem, and that's climate change. You mentioned rightly before also this is an issue. And if you look at the projections, you know, over the next 20, 30 years, how many more cities will be experiencing very hot temperatures over 35 degrees, you know, the heat waves, it's kind of scary to see. I mean, and it also goes very rapidly. Myself, I'm based in the Mediterranean region. It's one of the fastest warming regions, and it's a real issue where you actually can feel the changes already. So adaptation and climate mitigation measures are extremely important to this. And this is another way of looking at where we see, you know, the climate of cities moving towards the hemispheres. So, I mean, they say that, for example, Madrid is going to be like Marrakesh in a number of years. So you can see these changes, and we need to adapt to those, but also work on mitigation to address the issues. Of course, besides heat, we've got also flooding risks. Many of our cities are based in coastal regions, and many people will be at risk of flooding. Extremely important issue here. I mean, not only for the people there, the city, but also for the economy, because a lot of our, you know, economy is actually based in cities that are in coastal region as well. What we see is that also temperatures actually are going up, and one way to adapt or mitigate those is also through greening. And unfortunately, what we see as a trend is also that in cities there is actually the green space is reducing rather than increasing what you would be hoping for. As what I said, I mean, this is important, in particular also for the climate agenda, but also not only that, but also for people's health. We know that that green space is kind of essential for health for people to maintain a good health, I think I could say now, and also particular for mental health. We see many benefits of green space on mental health, or what we see in particular, the lack of green space leads to poor mental health, I think. So this is also to keep in mind that we should be looking at that. Now, one of the worrying trends, I think, what we see in many places over the last so many years, and it's probably still continuing, is sprawl. Urban sprawl. I mean, we're building, but we're not doing so well. We're getting more sprawl, what leads to, in particular, difficulties with mobility, with transport within cities, because, you know, you need to have longer distances. This also then leads to more climate change. It's more difficult to address difficulties in cities. So this is another issue, I think, that deserves attention. To see which direction we're going. Here, not only bringing in the urban planners, what was mentioned before, but also builders, because, you know, you see in many cities there is actually not much planning going on. People just build wherever and then expect the services to follow, what is, of course, not the right way of doing this. Here is some of the sprawl. What we would like to, I think personally, is also more compact cities. Barcelona is an example, more compact city, higher density, what has many different benefits. Of course, there are still challenges in those kind of cities. I mean, in my own city like Barcelona, we simply have too many cars, leads to too much air pollution, leads still to a health burden, but that's also could be addressed. Of course, there it's also the sustainable housing, what is important when you look at the climate agenda. If we're going to build, we should try to build also with a good quality and that houses that are resilient and you know, adapted to the new realities that we're actually going to face. Now, these houses are looking very fancy, to be honest, but hopefully you get the idea that we need to look at sustainability in the housing sector as well. One of the big problems I think we still see in cities that there is too much car-centric planning, or actually that there is a lack of planning. So it's everyone for them. So we get this kind of you know, everything is around the car, or that you need to have the car. And even in cities where the car is not the main mode of transport, they still take a lot of space that can be used in a much better way, and is also often quite expensive for people to get around. So in this way, we need to look more at people-centric planning, I think, trying to encourage what we heard before from Fiona, walking and cycling, but in particular also public transport. Most people still, or in cities, most people still go by public transport. So it's important to get there also the investments there. Also, we need to think about our public space. I mean, I use the example here from my city, from Barcelona, where we see where have been introduced the Barcelona superblocks, for example. What the idea there is also to reduce the car motorized traffic within these areas and encourage active transportation, and also at the same time do some greening to reduce the impacts of heat there. Of course, there have been other kind of what I call novel urban models that have been promoted, like the 15-minute city is quite popular, and there's a whole agenda around this, and I think it would be interesting if you could also link into that kind of agenda. It creates a lot of enthusiasm on local skills. Other things we see is like the low traffic neighborhoods or car-free neighborhoods. These are also kind of models, you know, that are good for the environment and at the same time also very good for health, and therefore I believe should be promoted. Finally, I think if you look at something aspirational, if you look at green space, I mentioned that it's also quite important. You have this new 330-300 green space rule that also many cities I see now trying to achieve or trying to talk about. And again, it's good for climate reasons, and at the same time, it's also very good for health, including mental health. Of course, the big issue still, and what we always come across, is inequalities, how you deal with those throughout what we just talked about. I mean, inequalities always come in where we see the differences, and you're fully aware of it. How to address it is, of course, much more difficult, but all the environmental issues, the planning, etc., they go together with inequalities. So we certainly need to keep this on the agenda, try to address this. Now, as a kind of positive message, I think we mentioned climate change. I would like to talk perhaps a bit more about climate action as such, because it's a positive agenda where we can make actually changes, and many cities are buying into this, where we see improvements both for the environment, for health, for climate. And this is coming from the Pathfinder report, where it gives specific examples of actions that are beneficial through all different sectors. I think there's a lot of activity going on, and in this way I hope that you also can pick this up further and promote this further. I mean, so not only talk about climate change, but in focusing on climate action. I think the key for me is that, you know, at the moment you're working together, I think UN Habitat is more in the urban planning, we're health, where we need to bring in other sectors where possible as well, or jump on the bandwagon to take advantage of this. I mean, in particular, climate action, I think there's a lot going on. We recently published a paper, you know, exploring kind of the nexus between urban form, transport, environment, and health. And it's amazing when you see what the evidence is out there. I mean, you can't address problems just from one or two sectors. You need to bring a lot together there. And I think that's also for you. I mean, if you work together, I mean, perhaps you can also work with others to promote agendas for this, because I mean, that's where it's happening. I don't know if Joe is slowing this slide, but I always promote the multi-sectoral systemic approaches to our urban health problems and urban systems. We need to bring lots of people together around the table. I mean, I'm still kind of surprised when I go to transport conferences, architectural conferences, even urban planning conferences, how low health is on the agenda. And I think many of those sectors have a really big impact on health and can actually do much more than the sector where I come from, the health sector. We need to be able to promote this. The other one that I would like to emphasize is education. Our future is in schools, and the education sector has quite a bit of power of what's going on in schools, around schools. Unfortunately, there are many initiatives to improve the school environment, in particular when you see around cooling the schools with also climate change. So this is also, I think, quite important, try to address that as well. So these are some of the issues I would like to bring to the table. Hopefully also you can address them within your memorandum of understanding and work around this kind of agenda, because I believe that are important. Thank you.
Thank you, Mark, for this great overview. I think it gave us and the next speakers some food for thought. Let us check the result of the Mentimeter if we can. So what we see is the most pressing public health challenge, given the answers of our audience. I see very big letters: heat, overcrowding, informal settlements, informality, access to services, climate change, and of course a lot of other areas. So I'm happy we identified well the speakers who will follow, because they will speak about some of these issues. And I would turn to Jason Korber, a professor in the Department of City and Regional Planning and School of Public Health, who directs the Institute of Urban and Regional Development and the Center for Global Healthy Cities at UC Berkeley. Well, Berkeley being in a time zone where he's still sleeping, he was kind enough to send us a pre-recorded message, and he said he will not be able to discuss with us, so he will ask provocative questions. So I'm looking forward to his questions.
Korber from UC Berkeley. I'm sorry I can't join you in person or live today. I was really looking forward to seeing friends and colleagues and having this really important conversation. I want to thank Graham and Natalie and others for inviting me, and apologize to Mark and Joe and Blessing and other friends that I can't be with you in the conversation, but I do hope there's some follow-up, and I'll try to be a little provocative with sharing some ideas. Let me share my screen and get right into it. So I'm not going to introduce myself. Hope you can see that on my screen, but lots of information about me, and hopefully can get some background context to some of my points. So I think the first challenge for me in urban health today and the work that we're doing is really to shift the focus really from health to healing. So many communities that we work with have been damaged. We focus too much on just assessing prior risks, hazards, disease, and premature mortality, and that's important. But we need to shift, in my view. We need to shift to how do we reverse these harms? And that doesn't just mean moving to health promotion. It means understanding what does it take for communities to heal from the traumas and stressors that have damaged their bodies and their communities over generations. And there's plenty of good science behind this, ideas of trauma-informed work and toxic stress, both in our individual experiences, but also in our communities. I think we need to do a better job to understand what does it mean to implement practices that are healing-centered rather than just health-centered. And I think there's an important distinction there. One of the really important things that we found in our work, working collaboratively with local governments and with communities is that the interventions, or whatever we do, science, the analysis, and the intervention, really has to add economic value to communities so that they can improve their health, not just their built environment or not just new physical infrastructure. So really for us, the question is, what does it mean to practice restorative urbanism? I think part of the response to that is to improve our participatory or citizen science and move that citizen science into practice, and even use that citizen science as a way of doing participatory evaluation. Again, focusing on assets and strengths, really lifting up what is working, even in high-risk environments, highly toxic, polluted places, places with lots of stressors and inequalities. There are some things that are working, not to romanticize it, but to identify those things with local people and lift those up in our science and in our policy. We also have incredible technology now that we need to take better advantage of. All the things probably that are on your body or in your pocket right now, from those mobile devices to other handheld sensors, we can use these things, and we are using them. I think urban health has not done as good a job as other fields yet to integrate this into our analysis and our policy making. Again, participatory upgrading. I know Habitat and WHO have been really supportive and leaders in this area. I think really going deeper into making health-specific participatory informal settlement or slum upgrading as a key strategy for housing and infrastructure and livelihoods is something that we need to explore moving forward. The third piece that I think we need to work better on is how do we move to more informed policy? And what I mean by that is, again, not just analysis, but policy that gets implemented and we evaluate whether it's working over time. And we have some good tools. I know Mark has been a real leader in health impact assessment, as well as others. And we can do rapid HIAs, again, in cities and with communities to really understand how our small scale interventions working, who they supporting, what are they supporting in terms of well-being, what are maybe unintended consequences, and how do we shift and adapt over time based on those rapid assessment tools. We really aren't training our urban and municipal officials in some of these tools, although they're out there that we should be using. And we have to really be attentive to the cultural and a very context-specific nature of many of these policies and implementation strategies. The final thing I'll say is I really believe we as a field and as research practitioners, scientists need to explore deeper this concept of neurourbanism, which I know most of you are familiar with, but really enhancing our understanding of neuroscience and how urban environments, urban living conditions don't just affect our mental health and our brains, but that affects our entire bodies and it affects entire communities. We know a lot about rewiring the brain through positive community environments, through enhancing social connections. And there have been great work for many, many years, in fact, a couple of decades at least in this area, but it's still too dominated by the architects, the designers, the psychiatrists, and even those in the green space, which is important, but insufficient in many ways to promote neurourbanism. Part of this, I think, raises some really important challenges for training and capacity building, for practitioners, for scientists, in our education space where I'm working. What does it really mean? What are the tools we need to move from health to healing in urban settings? How do we improve our participatory science so we get better data over time, not just more people participating, which is important, and improve the transparency and trust and legitimacy of public health science? I think we're facing that crisis today. What does it mean to really do urban implementation science with communities, not on or for them, but with them? And again, informing our urban science with really these innovations that I think are moving very quick on brain and stress science into how we think about built environments, environmental assessment, housing, service provision, and urban governance. So I hope that's been useful, and I look forward to hearing more from this seminar. And again, I apologize for not being able to join you. And I wish you all a pleasant day and good luck.
Well, I think some other new ideas, and I hope you will react to that later on the discussion. And I turn to Ms. Kobe Brandt, who has more than 25 years of practical and managerial experience in environmental management and urban development. She is the global director of the city's biodiversity center of ICLEI. I hope you will share with us your experience on empowering local governments, on implementing integrated policies, and some feedback from the local and regional governments community towards the health and urbanism community. The floor is yours, Kobe.
Thank you very much. I'm just going to try and share my screen, if that's okay. Let me just see if it's uploading. If you can see it. I'm not sure.
Yet.
Not yet. Okay. All right. Okay. Look. Wait. Let me just try one more time. Share. And I'll share screen there. Share. You can see?
Yes, now we can see.
Okay, all right. Let me go to slideshow and then I will close this box. Okay, so thank you very much for having ICLEI and myself here to join our friends at UN Habitat and WHO. We have MOUs with both of your organizations, and specifically with WHO, we've been working over the last couple of years to build up momentum around what we would call a One Health approach for cities. And with UN Habitat, we work on a myriad of things related to sustainable urban development, health not yet being one of them, but hopefully we can change that soon. I'm delighted about you coming together to discuss this very important topic today. And ICLEI very much supports your approach of collaboration between yourselves and hopefully with all of us as well when we talk about health and cities. And as we've heard from previous speakers, it's so connected to climate change and to sustainable development altogether. So thank you very much to our hosts. So I just want to, for those who don't know ICLEI, we are a network, and I'm very pleased and thank you also for hearing that people recognize the importance of city networks. So we serve directly more than 2,500 local and regional governments around the world on related issues to sustainable urban development, but we actually work with more than double that amount of cities, formally and informally, on climate change, a variety of issues related to sustainability, including biodiversity, including nature-based solutions, food systems, water systems, and of course also lately also health and the very different aspects of health. So we're active in over 125 countries and with several offices. This is just a bit of a glimpse of where we're most active. But you can see that our spread is really very much equally balanced between the global north and the global south, and we're really expanding quite rapidly also in Asia and in North Africa at the moment as well. There's rapid expansion as well as in the Pacific Oceania region. I think just a few remarks from our side. We've got to remember that in July 2022, it was quite groundbreaking that the UN General Assembly passed the resolution affirming the universal human right to access a clean, sustainable and healthy environment. And that also means in cities. This resolution calls upon countries, international entities, governments, and the private sector to increase their endeavors in guaranteeing a clean and healthy environment for all of us, while addressing the triple planetary crisis confronting our planet, that of the climate crisis, biodiversity loss, and pollution. Adequate housing, of course, is, as we all know in this room, a basic human right and one of the key social and environmental determinants of health, both physical and mental well-being. Climate change exacerbates existing vulnerabilities and it also entrenches inequalities. ICLEI, our organization, is committed to supporting local and regional governments around the world in addressing housing, climate change, and public health challenges in an integrated, systemic way, and with data-driven manners, and citizens-based science is very much part of that solution, tailored specifically to the local context. No two cities are alike. And through our five development pathways. Those 5 pathways really look at resilient development, net zero development, nature-based development, equity and people-centered development, and circular development. ICLEI has recently established our new global One Health City Centre, which falls under our biodiversity, nature and health program within ICLEI, to enable and empower the cities we work with to operationalize One Health principles, bridging biodiversity, climate and health in the urban context. The interconnected and interdependent connection between human health and a healthy environment is very clear. It is even more evident as the world grapples with this triple planetary crisis. An unhealthy environment can result in a myriad of significant negative health outcomes for humans and the planet alike.
I didn't understand.
Oops. Sorry, I just want to mute my phone here. We need to work with nature, not against nature. And if this planet is going to sustain our future generations, let alone for them to thrive or even survive. Climate change has a very direct and compounding impact on the housing health nexus, particularly in urban areas where vulnerable populations are concentrated. Extreme weather events, we've heard about that today before, can damage or destroy housing, especially in our informal settlements. This leads to very serious health impacts, and climate-driven displacement can impact communities, leading to a loss of access to healthcare, stress, malnutrition, and heightened vulnerability to disease outbreaks. And let's not forget that in a time of a crisis moment, whether it is a new pandemic, as we recently experienced through COVID, or whether it is an extreme weather event, we cannot reach those people often in informal settlements with early warning systems, etc. So investing in technologies, as our previous scene-setting speaker for this session pointed out, with cell phones and things that are really, technologies that are really accessible in our informal settlements and used by everybody to get through their days and organize themselves. We can use those very same technologies to improve early warning systems and even health information sharing, etc. And I think that a lot can be done in that regard. And I'm really excited about what UN Habitat and WHO can tackle together in that regard in terms of setting policy and creating new standards basically for how we can engage in that. And of course, ICLEI, being an implementing organization, we completely project-based. We stand ready and we implement and we pioneer those solutions all across the world, and particularly in the global south. To achieve the objective...
Please. Could you come to the conclusions, please?
Yes, I'll come to the conclusions. So, I'll come to the conclusions by saying that there are 4 key areas that I think is relevant to today's discussion. The one is green building and housing initiatives, net zero or net positive energy homes, green roofs and walls that promote better air quality, reduce urban heat island effects, and increase biodiversity. Secondly, nature-based urban ecosystem solutions, green spaces, play areas, green transport solutions, and people-centered urban design. Number 3, urban planning tools to optimize design and deployment of nature-based solutions. And lastly, number 4, but not least, health in all approach. The health in all approach to apply a health lens to all housing plans, including engagement of public health experts and integrated data systems, including health indicators. This will form an important part of the ICLEI One Health City Centre, and we invite WHO, UN Habitat, and everybody present here today to engage with us, if you're interested, to collaborate with us through that One Health City Centre. Thank you very much. I'll conclude with this.
Thank you very much, Kobe. And sorry I'm being sharp, keeping the time, but I would like to give the floor to our other speakers as well. Immediately I would turn to Professor Jo Ivy Buford, who is clinical professor of global public health and pediatrics at New York University, but she has also served as principal deputy assistant secretary for health in the US DHHS and US representative on the executive board of the WHO. So you are half at home with us. Could you share your experience working with healthcare delivery systems and at multiple levels of government, if I may ask, to bring your thoughts? Jo?
Yeah, thanks very much. Good morning from New York City. It's not as early as it was when we started, but anyway, it's nice to see old friends and new colleagues. I want to sort of take about maybe a half of the time, the brief time, talking about the healthcare delivery system and the links there, because I think we don't think about it as enough as a partner in this work. And then secondly, I want to just touch on a few things that have not yet been mentioned as in terms of looking at the future sort of UN Habitat strategic plan, but also revision of the MOU coming up. First of all, I have most of my career has been in US domestic healthcare delivery systems, the last 15 years or so, getting much more involved in public health, population health, and global health due to my service in the federal government. And I still feel like urban health is being looked at as a thing that we have to deal with, rather than understanding that as I observe, it's been sort of a paradigm shift in international development thinking, which much of its origins is in the rural areas. And I think if we really believe our own evidence that 70% of the world's population are going to live in cities over the next 10 to 15 years in all regions of the world, we need to stop thinking of urban health as an add-on or a focus area, as opposed to integrating it more naturally into the various initiatives that are developed. And I have not read carefully, but I want to mention the WHO latest work plan, which really highlights the 3 billions notion, the health for a billion, the healthcare access, and the health security. But the issue of the urban issues related to each of those areas is not very much expanded in the work plan. And so I think that's kind of a challenge. It's not that urban health isn't mentioned, but I think we need to see it more integrated, as to the degree that it is sometimes a special consideration in dealing with promoting health and healthcare systems and health security issues. So that's sort of for starters. The second reason I wanted to bring up the healthcare delivery system is that because obviously it's a major priority for WHO, but it is the dominant, it dominates policy and politics in most countries, the personal healthcare delivery system. And I think we're always struggling to get airtime for population health, or get people to think about public health other than during epidemic times, which is not the strongest suit in terms of working for positive reactions of the public. So a lot of my career, because I started out in clinical, has been trying to have this conversation that we've been having so eloquently so far this morning with my clinical colleagues. And it is not easy to have that conversation. And I just highlight 2 points in it. One, I think, is that many of my clinical colleagues, they sort of begin to understand that if they see the patient in the clinical enterprise and send them home to conditions that made them sick in the first place, they need to worry about that. It's not, it's a problem, and they are beginning to understand that. And that, in my experience, it's pretty recent, really. But then the next thing that comes up is, but that's not our job. We're super busy here taking care of patients. We don't have the money. We're too stressed. And I would say, as a physician, I can say this. I think the healthcare delivery system and physicians are notoriously poor at partnering. We're sort of taught in medical school, and everybody's taught we have legal responsibility if something goes wrong. And a lot of the hospital systems, I think, don't have very poor experience in partnering with nonprofits, even in their own community or with government. And I'm just reflecting on having seen this through the ISUH colleagues and certainly in the United States. So I think we need to really think about what the personal healthcare delivery system can do for us in advocating broader action in urban health as partners. They have the political leverage. Most of the money is in that system. The workforce is there. They are a source of major economic development in their community. So they have a lot of power in this conversation. And I think not trying to embed attention to urban health variables in that conversation is a mistake. And I wanted to give one example from the US quite recently on the housing issue, which is the focus of this morning's seminar. A lot in the United States, the Medicaid program is shared between state and federal government funding. And the Medicaid program is for the poorest of the sort of lowest income Americans, and provides them with health insurance coverage. In recent years, Medicaid, through waiver applications that the states can go to the federal government, can provide funding through the Medicaid program for housing. Why? The reason is because the realization is that housing is a major determinant of health, and also is a major issue for patients who, should you excuse the expression, block beds, who stay in the hospital a long period of time. Beds can't be freed up. It sort of hampers the hospital functioning and turnover. So there's a variety of waivers that have provided states with significant amount of flexibility in supporting housing for certain patients with certain complex illnesses, especially mental and chronic diseases. And they are allowed to spend up to 3% of Medicaid funding on housing-related expenses for their patients. And you can say, well, this isn't huge, but in California, for example, 3% of their Medicaid budget is $4 billion being invested in the housing sector. So I was surprised that in the Mentimeter, I would have thought financing would be a major issue in housing, because it certainly is in the United States. I can't think of, I can't speak to other countries dominantly, but I think it must be a huge issue in many countries. And then the final reason, I think, for the partnership, and I'm not going to take the time, I have one slide I was going to show you, but I can send it later. When I think about the coordination between the clinical sector, I sort of think about a slide. If you think on the left-hand side is the more traditional medical model, which is sustainable health systems, workforce, medical products, and universal coverage. On the right side could be the broader determinants of health, the areas of planning and built environment, natural environment, et cetera. And they sort of sit side by side in my brain, and I think in the urban health paradigm. What they can help each other, because the real issue, we talk about various diseases of urbanization and prevention of NCDs in urban settings, a lot of work going on there. But we don't talk as much about prevention as we need to. And I think we're trying to focus on primary care in the healthcare delivery system. That's a big issue in cities. And we're also trying to focus more on prevention in the clinical space, which is not well paid for and not terribly well attended to. But there's a complementarity if we can collaborate. I think WHO, UN Habitat, and other partners on the prevention agenda in both sectors. And then I just wanted to hit very briefly on 3 or 4 issues that Mark Neuenhausen's, as always, talk on health and all policies, and his article, which I make all my students read, so articulately talks about the challenge of health and health governance at city level, really important. And Jason's challenges are fantastic. So I just want to touch on a couple of things that I'd like to emphasize for the MOU revision for UN Habitat Strategic Plan and potentially for the program of work. I think it's really, first of all, is to focus on the SDGs. I think that in going forward, if we look, there's an opportunity for WHO and UN Habitat to really focus on increased alignment and complementary metrics developed for SDG 3 and SDG 11. If you look at SDG 3, it never talks about urban. SDG 11 is a whole set of what I would call determinants of health, and the word health is never any place in SDG 11. And so I think there's a real opportunity there going forward to think about getting some incredible brains from both agencies wrapped around aligning those issues, and especially looking at the metrics to be complementary. NCDs is a strong suit of 3. It's a huge issue in all of the bullets under SDG 11 in terms of the opportunities for creating public spaces. The second issue was mentioned, but it can't be mentioned enough, is data. We all end up a lot of our conversations with the problems of data at urban level and suburban level, and it needs to get attention. It's got financial implications, but again, as agencies, I think thinking about data to advance urban health. Third issue has been discussed is governance. I think the UN SDGs calls for countries to look at decentralization so that local government cities have more authority to make the kinds of changes we've been talking about. I don't think there are really many regions of the world where local government has very little authority or responsibility. I'm thinking especially of Africa. Even now the UK is now decentralizing to local government. It's really interesting. But, you know, I think this is an area where both agencies could be super helpful. And one of the issues that comes up in that decentralization is what is the role of ministries of health or health departments in cities? They tend to be quite weak. We imagine they are going to be conveners, sort of help influence political leadership to promote health in all policies, but that shoring up, if you will, or the partnership between planning agencies and housing and urban is very interesting, and cities at local level is really interesting. And then just 3 last quick things. The fourth one is migration. We haven't talked much about that. Our colleagues from the International Organization of Migration, who presented at the International Conference on Urban Health, have been very clear that cities need to stop thinking about migration as an emergency and start thinking about it as a way of life, as a way of being. And I think that's a real challenge going forward for both agencies. The demographic shifts is one of the great, public health challenges going forward. We've heard about youth. Thiago talked about older persons, but I think the implications of engaging youth and older people in decision-making, in community engagement, there are a lot of models, a lot of folks are doing it already, but kind of thinking about the implications of that youth bulge in many regions and the good news of public health, which is people are living longer. How do you make healthy longevity a priority, not just longevity isolated? And this was touched on by Jason, so important, this issue of finally post-conflict rebuilding in cities. Sadly, this is becoming a really, really important and unfortunately continuing and expanding issue. I've been working with colleagues as a UN Habitat project on Anthedon, kind of reimagining Gaza and Palestine, Syria, Sudan, Ukraine. I mean, these are wars, urban warfare, and the legacy of the destruction and rebuilding and healing, I think, is something that needs to be on the agenda that, 5 years ago, when any of this was designed, would not have been a concern. So I'll stop there. Thank you.
Thank you very much, Joe, and thank you very much for concluding on this point of post-conflict reconstruction, because you ease my task to link to our next speaker, Alan Maina, who is Chief of Public Health Section at the UNHCR, a medical doctor himself with a master's degree in public health, with first-hand experience as a clinician in refugee camps, for example, in northern Kenya, but also experience in Africa, Europe, and Asia, and the Middle East. So I guess you will offer us slightly different approach, and we are open to all new ideas and comments.
All right, great, thanks, and great to be here. Really, thank you very much, Graham and Felix. It's an honor to be here to speak to this, but also listening to the scope of work that is going on around urban health, because we don't speak about it enough in many contexts when we discuss overall health. And I appreciate the focus on this aspect. I think one of the key things that we know is that for refugees, for example, we have more than 35 million refugees, and the numbers continue to grow. Over 60% of them are in urban locations. So displacement, or rather urban displacement, is really becoming the norm. And in recognizing that, we're also seeing that cities are not always able, ready, or prepared to handle this situation of displacement. I note the previous speaker speaking about the migration becoming a way of life, and we're able to live with that. And it's also similar to this concept of refugees. And this is one of the things that I wanted to say earlier, but I thought I'd say here around the work on the MOU to WHO and UN Habitat. We appreciate that it includes a mention of migrants, refugees, among other vulnerable populations. But we need to see how much more in the next iteration of the MOU we can do to document how inclusive health policies could be established in urban situations. They tend to be left out. There are similar health conditions as we've noted as the poor dwellers in urban locations, facing the same challenges: access to non-communicable disease care and support, outbreak of diseases. They are mostly in marginalized locations with open sewers, overcrowded living conditions, a lot of similar living conditions as we're seeing in settlements, in camps, unfortunately. They're not always able to access the more sustainable housing solutions that we are discussing here. We're glad to know that we have an MOU with WHO as well as the UN Habitat. So I'm happy, I'm feeling in good company because these are some of the things that we're looking at. And I do note that in our strategic guidance together with UN Habitat for 2020, emphasize a few key elements which are also in the current strategic plan for UN Habitat 2026 to 2029. And that's around inclusive governance and equitable housing, as well as resilient communities. And I think this has to be emphasized in how we collaborate going forward. How do we ensure that when we talk about equity, it means everyone, regardless of who they are and wherever they are located. I was happy to notice some of the work that is going on in Kenya, for example, the road that was constructed by the community, and realizing the resilience of the communities and how we can ensure that every fabric of the community is well represented, because it tends, in a social cohesive society, we don't always have all the community representatives being very equitable, and some of these refugees are left out in those discussions, in those community initiatives or community-based organizations. There are a number of refugee-led organizations and community-based organizations that are stepping up, and we're seeing a lot of that in the Americas, for example. Some of the work that we're doing linked to this is, we know we have the strategic plan is also aligned with the refugee framework that we have called the Global Compact on Refugees that was found by states at the UN General Assembly in 2016. And we have every 4 years a review meeting, taking stock of the support, solidarity with the refugees, looking at responsibility sharing, burden and responsibility sharing, especially the host countries, to be able to ease the burden of hosting refugees, but also trying to find solutions and also addressing the issue of the country of origin and the conflict that caused the displacement in the first place. And one of these areas where key multi-stakeholder pledges that have been pledged in the last forum in 2023, one is on human settlement and how we can promote the idea of livable, safe, and community resilient structures, and working with communities to have settlements moving away from a camp context to a settlement idea where people also have land, looking at human development aspects, and they can be able to make a living and contribute to the economy where they are. And then there's evidence to show how the refugees help to contribute to the local economy wherever they are located. And they should be seen as an asset, empowered, given the rights to move and make it a reality. In many cases, they're constrained in terms of the ability to move and access other opportunities. So that is one on human settlement. Is another one that we have on health inclusion and health system strengthening. And we have a group of friends that we are co-convening with WHO, and we have multiple stakeholders coming in to pledge support, and some of them are cities, and we've seen cities as key partners in pledging inclusion in national systems, and we have examples also in the Americas where we're seeing some of the solidarity with a solidarity concept that is coming up to ensure that refugees are not just mentioned for the sake of saying that they should be included. They're actually ensuring that their plans and their design and efforts are made to include refugees in those discussions. The examples on how we advance, and I think this is something of interest, because when we discuss urbanization, urban situations, we also note that in many settlements, we find that refugees are in rural areas that are fast moving towards urbanization. And we worked with UN Habitat, for example, in Kenya, where we have northern Kenya, a settlement that is being converted into a municipality and quickly becoming urbanized. And how we can see such locations and work together to be able to, with the cities and municipalities, to build a society that has an inclusive urban health policy and has the housing concept that captures the key elements that we've all said here in terms of sustainability and beyond even the refugee situation, because it helps the host community, the local community. It's not just about just the refugees themselves. We also seen in Iraq, they purposely decided to have an urbanization policy where refugees were in camps, sort of gated settlements, and then decided, yeah, pull down the walls, refugees will live among the urban population, and now they promoted an urbanization policy and looked at an area-based approach to ensure facilities are mapped out and established to address the needs of both refugees and the communities there, as though they are part of the whole town or urban situation. And this is where we're going, where the planning for different locations is inclusive of every kind of person that is there, and they're able to freely move around and access services equitably. In addition to this is the empowerment of the refugees, certification of refugees to be able to work in health facilities, to be able, and this is a challenge that we're seeing, where there's a lot of potential for refugees to be able to work, but they're not given that opportunity. Education is also a challenge, where they can be able to advance the education and be able to contribute to the society, and be able to eventually contribute to rebuilding their country when they go back. I was happy the previous speaker spoke about post-conflict and also rebuilding and recovery, and this is something I wanted to note earlier, because it's an element that is captured in the UN Habitat Strategic Plan, but it's not very strong in the MOU. Maybe I've not heard much about how we're doing in that regard. And here when you think about Syria, Ukraine, Somalia, and other places where rebuilding and reconstructing is very important, I think we need to see how to work, not wait for them to sustainably return, but then how to already work with these societies to be able to build systems and infrastructure that can be able to welcome the people back. Because many of them do what you call go and see, and they see that the services are inadequate, they're not willing and interested to go back. So some food for thought in terms of that rapid urbanization of settlements, the sustainable housing aspects, and also the housing, land, and property rights, and ensuring that we can be able to consider this to mitigate any conflict and among refugees and host communities, ensuring social cohesion, and the aspect of human development, as I noted. Lastly, I just say that, I mean, we all know this, and we need to emphasize that inclusion fosters resilience, and so that is important in terms of what every community can bring to the aspect of sustainable housing. That universal health access is critical to sustainable urban futures, as well as cities, again, as I said earlier, are as critical partners for rights-based solutions going forward. We note, for example, in the last point around data, and you talked about disaggregation of data and how we monitor. I think, for example, we have this, what we call the Health Access and Utilization Survey, where we assess among urban population, the access to services, the barriers they face, continually see barriers around inclusion in social health protection platforms in health insurance, and many are not able to pay for that health insurance in urban situations. We are seeing, like, for example, in Jordan and Lebanon, around 16% or 20% of the refugees have non-communicable diseases, but more than 60% say they're not able to afford paying for those services. You'll almost have comparable challenges for the nationals, but they have also access to job opportunities and labor. So these are some of the thoughts that we need to keep in mind and note some successes, like in Peru and Colombia and other places where they've allowed refugees to be able to, and migrants, to be able to have to be registered and included in the social health protection platforms. Some waivers that have been introduced even in Moldova with the Ukraine situation, with temporary protection directives to allow refugees to be able to access services in the urban populations like the nationals. And I think we need to encourage more of that, this kind of initiatives. I think the new MOU and the work that we will have going forward, we need to document this more and bring it to the table in governance discussions on how we can advance these inclusive policies and document the great examples from the countries that are setting the pace for us. Thank you.
Thank you very much. Thank you very much for all these new aspects. I think more we discuss, more you will have on the plate to take into account. You mentioned several examples from Africa, so I would like to turn to Dr. Blessing Peru, who is Senior Research Scientist and Head of Population Dynamics and Urbanization Program at African Population and Health Research Center, and an Honorary Professor of Demography and Population Studies at the University of Witwatersrand. You are also Advisory Council member of the International Society for Urban Health, and I'm pretty sure you will give us some example from your experience there. Blessing, the floor is yours.
Yeah, thanks everyone. Thanks for inviting me. I'm happy to meet up again with friends. Joe, I see you. I see Natalie. I see many of you. So I'm really happy for this opportunity. And I like also the title of this meeting, Addressing Urban Health Challenges in a Changing World. Actually, as things seem to change, they remain the same. In sociology, we are taught that change is a permanent future. So in my intervention, I want to highlight the shift from identifying problems, and that has to continue. We need to continue to identify problems. As we address some old ones, new ones become prominent. But I want to emphasize our increasing focus on identifying and testing solutions for sustainable and inclusive urbanization in Africa. And as I listened to all the presentations already, most of those are speaking to solutions. Of course, the real gap, which I want to emphasize also, is what the gap that remains as far as investment is concerned, as far as implementation. And I've had a lot of comments from previous speakers on governance issues. Who makes this decision? Who decides what to be invested in? So, and I think that is a gap I want to highlight. Of course, I want to emphasize 3 areas. What I did was just to highlight the 3 areas I think we have already identified solutions. And from everything presented, you could actually see that what I'm going to do is fundamentally to reiterate. For example, there is considerable consensus, even from today's presentation, that providing municipalities, city managers, specific countries, NGOs, donors, policymakers, provision of more granular data at the very local levels, because these are where some of these challenges, that's where they reside. Providing those data will help to prioritize interventions, prioritize investments evaluate what works or otherwise, and inform policy options and actions. There is quite substantial consensus on that. In the same way, it is also have been shown that co-creation of evidence, co-creation of solutions through community-based participatory research approaches, consultations, meetings, workshops like this, working with community advisory committees, youth groups, and even just mentioned co-researchers, you know, citizen scientists, scientists from the community. Working with them, we have been proven to be very critical in sustainable urbanization agenda, in improvement of both maternal, newborn, and child health outcomes. That, again, is an area that consensus has actually been reached. The third point is the issue around housing. We have this evidence, and I think Jesse also mentioned it, and it's actually the same. We mentioned the Mukuru spatial plan. We can confirm that housing stress in urban informal settlements can be addressed through spatial planning areas. And I think the last speaker mentioned that in terms of how you want to incorporate refugees into the city, into the planning of the area, into participation in livelihood opportunities. So spatial planning areas, which is planning by bringing stakeholders together. You know, it causes a lot of list of disruptions instead of this issue of, you know, uprooting the whole communities, asking them to leave so that the urban planning will happen and development. So those three areas for me are critical areas. I think we have found solutions that then needs investments to move that forward. Okay, as of today, as we move forward, the investment in these areas remain very meager, if at all. And the third, so what I am doing here, which is actually my last slide here, is to identify just specific areas. And I think you can locate any of these in some of the presentations already made. For example, Joe mentioned the SDGs. Okay, but how do we monitor SDGs? Most of the time it is monitored at the national level. But what we are seeing is the need for monitoring, reporting, and verification frameworks that are developed locally to enable monitoring of progress, monitoring of investments, to pinpoint gaps and identify local priorities that would then deliver critical development and health goals that will push us towards achieving sustainability, particularly in the global south. I know there is some progress made in this kind of frameworks in the global north, but I think that is an area I think is very important. Second, there is the point around, and I think it also come up here, education, capacity building. The critical mass of expertise among stakeholders is actually lacking. In Kenya, where we work, our headquarters is, they devolved functions. The new constitution devolved functions to the counties, but they did not devolve expertise. And so investment in that area becomes important, including doctoral level researchers and, you know, officers of government, particularly at the local levels. We think that that is also an important area for investment, an area to look at, so that you have experts who can develop theories of change, who can monitor frameworks, who can help accelerate service delivery, who are able to test what works and what does not work. Education, critical investment in that field. Emphasis on strengthening the health system from below, across the last mile. It is very, very important. COVID taught us a lot of lessons. For example, we have these community health workers in many places that are called community health volunteers. Kenya has promoted their title to community health promoters. But what is really what's their career trajectory? What are the vulnerabilities themselves are exposed to? You can give them assignments, but they lack the expertise needed. They are not trained as they should be. They don't have all the tools. It's like sending vulnerable people to go and address vulnerabilities. You know, the saying that, you know, physician, heal thyself. I think it should apply here. So how do we strengthen that group? People at the last mile of the health system, because they are the real foot soldiers. They are the people that interact with mostly the urban poor, who are actually majority of urban dwellers. Then let me talk about availability and expertise to deploy digital technologies, to deploy GIS and Earth observation. We just came back from Hanover, and AI tools. AI is a tool, but you already know that the Global South is actually, I don't know whether they have really started in that direction. So there is also going to be a kind of inequities if we don't begin to highlight digital technology, the use of AI, particularly in the Global South.
Could you come to your conclusions?
Yes, just the last two sentences. Investment on climate change and health, especially on mental well-being. And I meant that deliberate choice, beyond mental health. Mental well-being, which includes the stressors, the social determinants, which actually is the major part of achieving health at local levels. Finally, I just want to introduce us to some of the work we're already doing, particularly to bring African voices to these global discussions. We have this book that came out actually last month. It is Urban Health in Africa, where we brought African and Africanist scholars to begin to articulate agenda, what is happening and where we should go. I think it's also a good book to recommend to all of us. I think it's published by John Hopkins and it's Arthur Mason. But having said that, these are some of the issues I thought I would want to emphasize here. I will be able to share this slide if it is needed. Thank you very much.
Thank you very much, Blessing. And thank you very much for re-raising some of the issues, like the use of data, like capacity building. Actually, after our last speaker, Annelies, we will have another poll, which will also deal with these issues. So prepare your phones for that. And last but not least, let me turn to you, Annelies. You are team lead for vaccine development at the World Health Organization, but also honorary professor of emerging infection diseases at the London School of Hygiene and Tropical Medicine, and the past president of the International Society of Travel Medicine. Your expertise on COVID, on dengue, Zika, and yellow fever are becoming, as we heard, urban issues. So we are eager to hear from you. And I cannot avoid mentioning that on these pandemic prevention and preparedness issues, we also worked with the Global Parliament of Mayors when the negotiations on the new agreement at the WHO started, and provided a mayor's declaration on better pandemic prevention, preparedness and response, what we used as other relevant stakeholder during the negotiations. So I'm also eager to hear your points on that. Annelies, the floor is yours.
Thank you so much. In the interest of time, I'm going to bring the argument first. I want to argue that control of vector-borne diseases should be positioned as a fundamental component of any urban development, especially urban development in low to middle income countries. And of all the vector-borne diseases, dengue is the one that poses the biggest public health threat ever. So what is dengue? Dengue is a viral disease transmitted by Aedes mosquitoes. Now, Aedes mosquitoes are particularly well adapted to urban life. They can breed in any type of water, even minimal amounts of water as a result of human waste in little holes or plastics. And they therefore really thrive on human proximity where humans cause a lot of litter. The mosquitoes bite actually during the day and can take several blood feeds. So if people are close together, it really leads to the proliferation of the mosquitoes and the disease. So the higher the population density, the higher the propensity for this virus to circulate. And there are about 5 billion people now living in areas infested with Aedes. And also of interest is not only dengue, but also Zika, chikungunya, yellow fever. So it now really dengue poses a threat to more than 5 billion people in the tropics and subtropics. Here you see the geographic limits. That said, though, we've now seen expansion of the geographic limits, both north to south, also to temperate areas. There are about 100 million cases per year with 20,000 deaths. So 20,000 deaths is not a lot in the global scale, but it's the hospitalizations. It really overwhelms the hospital systems. Dengue, and that's so interesting, has seen a 400% increase over the past 30 years. More than any other disease, much more than malaria, which now triggers and hovers around 10 or minus 20%. This has seen a 400% increase. And it's really driven because of unplanned urbanization, where we have high population densities as seen here, but also inappropriate infrastructure, inappropriate or suboptimal waste management, and a lot of communities throwing out litter that all can lead to the growth of these mosquitoes. And, you know, dengue really is a problem of Asia and Latin America. But now we see increasing dengue activity also in Africa. And that is because Africa, as already was said, is seeing increasing numbers of megacities. And Africa is going to be now the future problem for dengue. And the projected future growth does not look good. So this is now projected based on various factors. I could go into the scientific details, but you can see if you just zoom into the red spots and also into India and in Southeast Asia, where you will see a lot of this future growth occurring. So now is the time to act. And really for this purpose, we have set up a Lancet Commission. With cities expanding now at an unprecedented rate, we actually have a window of opportunity where some cities are just starting to be built, especially in Africa, where the megacity explosion is happening, is really to act now as the cost of inaction would be immense and unacceptable. For example, I just heard that Indonesia is building its own new capital. So when you start from afresh, learning all the lessons, how to reduce vector-borne diseases, you can actually make an early impact. This is a slide that the Lancet Commission put together. On the left in pink, this is what is happening now. We have reactive responses. We have an outbreak, we respond. We use existing control measures, and vector control is very difficult to scale up. It's very expensive to sustain. So unless, and with increasing force of infection, as we're now seeing with dengue, unless we do something in addition, we will not be able to address this public health threat. So the Lancet Commission is proposing a building out Aedes plan. This is a local adapted policy, locally implemented at city level by mayors and by policymakers to have strategies in place that now improve city design to build out the possibilities for Aedes mosquitoes to grow. Here, I would really like to summarize. So we need to move away from a very fragmented disease-specific strategy that we're currently using to really using a transformation of the urban environment to remove mosquitoes, while of course at the same time improving the overall health and quality of life for many of the other measures that you have all already listed. And the escalating threat from Aedes-borne diseases demands coordinated action. And we hope that this Lancet Commission, which is evidence-based, and will put together an action plan that is actionable, that you will take this on as city mayors, as urban planners, in your institutions, in your NGOs, etc., to have a roadmap how now to address this, the problem of vector-borne diseases. And I would like to end here. Thank you.
Thank you very much, Anneli. And I'm really happy to conclude our list of interventions on this example where the global and the local level can and should work together. We are running out of time, unfortunately, so I will not open up the floor for questions and answers, but I would like to give the opportunity, at least for our colleagues, experts here around the table, to comment. And in the meantime, I will open our Mentimeter poll, and please join us and answer the question: which type of support do you consider the most critical to effectively address urban health challenges? And you can choose from policy guidance, capacity building, implementation tools, or high quality disaggregated data. All of these were mentioned during the discussions. We are very curious how the opinion will be formed. And I'm looking around in the meantime the table. And Nick, please.
Yeah, okay, so this is a fascinating discussion. And I'm trying to put my hat on as if I was a mayor or elected official in an urban setting or a public health leader. And my head would be spinning by now. This is a problem that we, as professionals, technical expertise, face. And I see it in one small area that I'm involved in, which is the non-communicable disease agenda, where we all are highlighting the importance of obesity, physical inactivity, treatment, management, health system responses, tobacco control, alcohol. And we struggle to get a coherent narrative that is understandable or sufficiently prioritized for elected officials. And I put up on the screen earlier when I thought what the priority area was, it's around governance, because it always comes back to governance. And I feel that we are, as a group of professionals committed to this, singing our individual areas always. And I don't know how we get a coherent, prioritized narrative to those mayors, those elected officials. And I struggle with that. So I'm not coming with a solution. All I'm saying is that I don't think we've got it right, because I think we just overwhelm people.
Thank you very much. Any other comment? Yes, Laura.
I'd like to just pick up on some of the points that have been mentioned today. And I'll begin by going back to 1994, when urban health was put on the agenda for the first time at the Ministerial Conference of Environment and Health in Helsinki. And I was fortunate to give the keynote address at that session, chaired by the late Simon Weil. And I think it's important to just step back and look at the shifts that have occurred in the last 30 years, because I think they are really influencing our agenda, whether we like it or not. And it responds to the point that was just made about how do you have a coherent narrative when we live in a world of increasing diverse opinions, values, and heterogeneous viewpoints. And the first thing I think that we have to remember in the last 30 years is we've got reduced public financing for social housing, for urban infrastructure, and for community services, including health. And that's basically a worldwide trend. The second is the privatization of social housing, of public or local authority housing and community services, including health. And the third, and the most worrying one in addition to the first two, is the whole question of deregulation. We've had a deregulation of the housing sector. We've had a deregulation of the land use planning sector. And so it comes back to a question that was raised by several of you: who's responsible? Nobody wants to be responsible. And that's really becoming quite problematic. And in relationship to that deregulation, we've had this trend, which we've discussed here today, on densification. So the built environment has become more dense, and not for quality of life reasons, despite the discourse on the smart city or the compact city, and certainly not for public health reasons. It's basically agenda driven by commodification, led by the real estate sector, and return on investment on property as an investment sector. So I think this is the worldwide context in which we're trying to conduct and put forward our agenda on urban health, and it becomes a very, very difficult one, I think, compared to 30 years ago, for the reasons I've just mentioned. And that means, I think we come back to the question that we've discussed, perhaps indirectly, but I'm really worried about that we need to influence the professional. I think I don't challenge that, but it doesn't go far enough. The ones who are deciding are the people who are investing in the real estate sector. And I think that we have to admit that. And unfortunately, most of the documents in UN agencies don't come to this reality of the real estate market and the way it's driving urbanisation and created so many of the problems that we've been discussing here today. So where do we go from here? Well, I think we need more regulation. We have to have, and I'm not sure how that's going to happen in the world moving more and more towards the neo-liberal economic agenda. But I think there is hope, and I think there are some ways that we can try and develop, and I've tried to develop this in my recent work, and that is this whole question about accepting there are diverse values, diverse opinions, and looking at this governance and multi-tiered governance that we've been talking about in terms of dialogue, negotiation, and above all, trade-offs. And trade-offs are extremely important. And I think there we've got this very important concept from WHO that was endorsed in 2012 of co-benefits, and how co-benefits enable to create win-win situations rather than winners and losers. And I think we've got very interesting examples in the urban health and housing sectors, in the transport, mobility, active living sectors, and we're getting those published now. But the key point will be, how then do we bring in the private sector, not just the policymakers? How do we bring in the private sector to accept that these co-benefits can be used as an argument that investments in public health are also good for the economy and the financial sector? And I stop there.
Thank you very much. Great intervention. You once again emphasized that other speaker investment financing, which was missing from the first word bubble. Nick, you mentioned governance. It was also missing from the first bubble. So any last chance for a comment around the table? If not, yes, please.
Very brief from the control of neglected population. So neglected population, either migration or, this human factor. Added to all of what you mentioned, either migration, either aging. The human factor as the determinant. Working with community health, really community health, or civil society organized, And at the end of the day, this capacity of dialogue, not multi-sectoral, inter-sectoral, design, development, implementation, assessment of impact. I mean, this capacity of dialogue, really dialogue, otherwise will be very, very. When we work with this planet health, we are in a planet health movement. The biggest challenge was coordination, but coordination needs dialogue.
Thank you very much. Very important point, coordination, dialogue among intersectors and among stakeholders. Before I give you the floor for 2 minutes at the end, Graham and Natalie, let me ask the first question and see if any of the opinions has changed. We asked at the beginning, what do you see as the most pressing public health challenge linked to housing conditions? Could you all please rewrite your most important pressing public health challenge to see if there were any shift of opinion during our discussion at Mentimeter? And while you are writing this, I will use this opportunity to make some self-promotion because heat was mentioned, and I just want to advise all of you that on the 27th of May, the Global Cities Hub will organize a Cities Beat the Heat event, which will be at the intersection of rising temperatures, environment, climate, health, housing. So interesting discussion. And the responses are arriving slow, so I give you back the floor, Graham, Natalie, and at the end of your conclusions, we will have the new picture.
Sure. Thanks, Graham. Thanks, Andras. So obviously a lot to reflect on, and it's been an extremely useful conversation and exchange, and I think a lot of food for thought, and also a lot of recognition that while a lot has been done, still a lot needs to be done, but I think we are on the good way. Just a couple of thoughts. Just one thing I wanted to mention that actually captures some of the comments right now. WHO is currently finalizing the development of what we call the strategic guide on urban health, obviously in collaboration with UN Habitat and other colleagues. And the reason why I'm mentioning this is that actually that strategic guide aims to address a couple of issues that have been mentioned. First of all, it was Joe mentioned before, is that urban health is not an add-on, but needs to be seen as something that is integrated. And the strategic guide really aims of making the case of seeing urban health not as a standalone programmatic area, but actually using urban health as a way of integrating a lot of different demographic, political, socioeconomic processes that do happen at the very local level and that influence health. And therefore, health is the integral part of it. And if you understand urban health as such, it's a strong argument, right, for the investments. And it also relates to that, the fact of the co-benefits, because actually, if you take an integrated approach to urban health, you actually make the case that investing in health will have co-benefit, and investing in climate, resilience, etc., will have a benefit on health. So therefore, that's the second. And the third is that strategic guide actually brings forward also the argument that Nick was making, that what is missing is governance. We know a lot, right? We know what's happening. We know that entities are, an increasing risk. There is knowledge is there. We also have actually quite a lot of knowledge about key interventions, but how to make them happen is the complicated part. And the strategic guide will aim to address some of those issues. So having said this, maybe as a reflection for the next step, right? And these are just food for thought, right? And it's just is that for the further MOU as well, right? And also for the collaboration, then the next step would be to really move into the implementation. So this brings me to some of the reflections about the current MOU and the future MOU. And it's up, we didn't discuss this, so it's really my thoughts right now. it's that actually, while I agree that maybe the next MOU should definitely aim at looking at some of those topics that may have not been addressed sufficiently, climate change, mental health, sustainable transport, etc., maybe a focus should be also more on the implementation, right? And also actually to those enablers that we discussed earlier on. Because what will make the change is if we work collectively in a way to make the things implement on the ground. So that would be the first one. It also might be interesting maybe, and I think we have not been good enough, and I'm saying this, to communicate actually on the achievements that have been made in addressing all those different areas within the MOU. And so we need to find mechanisms to communicate to our respective constituencies, you know, this collective joint work. So I'm really to make the change happen. The third is just housing, maybe could be one topic that brings people together, right? So I'm not saying that the MOU should be everything only about housing, but it could have a strong focus there because it brings people together. And because we are running out of time, I just want to finish by one thing. I don't know if it's gonna, you know, be blessed and we'll see where we are. But Nick, you started the very beginning of this meeting or this session, pardon me, by speaking at the famous SDG 11.1.1 indicator that within Global Program of Work 14 for WHO has been retained as a health outcome, right, indicator. If this is blessed, and so this is a major achievement for me. And I can tell you, we have been fighting for this because having an indicator that is, you know, actually an UN Habitat indicator about informal settlements, you know, is actually key information about how people live, how their health is. So I agree with Joe that health needs to be more visible, but actually if there is a recognition that that SDG is a health indicator, this is a major achievement. And for me, this would be actually a key statement, right, of the achievement of a collaboration. So this would be my closing word, and over to Graham.
Excellent. Thanks very much. Well, I thought it was, I expected it to be an engaging conversation this afternoon, but of course it excelled because there were lots of issues that came up onto the table, some of which we could have predicted and some of which we couldn't. I'll also go back to Nick's comment, and I always have this recurrent dream, I say dream rather than a nightmare, that, you know, if you're a city official and you're suddenly faced with multiple health threats, where do you spend your money for the best outcome? That's ultimately the question that, you know, a local authority, mayor or somebody needs to address. And I don't think we do enough to guide local authorities on where they should put their money if they want the best health outcomes. So I think I'm fully in agreement with the issues on governance. But, you know, I think we need to understand that. And I mean, I'd like to go back to what Annalise was saying. Yeah, okay, dengue doesn't kill many people, but the impact it can have if the hospital is full of people with dengue on other causes of death is something we don't even think about, right? So we need to understand broadly how these diseases will affect. They may not kill people, which is what we look at, you know, at the moment. You know, we don't think about all these people who are suffering from neglected tropical diseases, whose productivity and contribution to life is forgotten. So we need to have a much more broader aspect. So I think there's a lot to be done in that area, and I still think in the new MOU we need to maintain some of the thematic disease groups, if you want. I mean, I think that's very, very important. We also need to rethink how we look at the health systems and the governance side in the MOU. That's very, very important. I think the housing and health, the opportunity for the housing and health guidelines is a great flagship activity. And if we're going slightly beyond the house to look at the neighborhood and the urban environment in the new guidelines, so we broaden our concept of housing a little, we're going to capture most of the issues that we're interested in dealing with, because, you know, if that's basic services, that's a municipal authority, and that can also come into what we plan to do. By way of the sort of next steps and outcome of this meeting, and indeed others, we of course are immediately going to start working on a new MOU, even though the other one doesn't expire till next year. We want to start working on it now. We will try and plan a series of maybe more dedicated consultations on some of the themes which we didn't have enough opportunity to go into this afternoon. So mental health would be a good example and other things like that. We can do that to broaden our knowledge. We also think, and Natalie and I think it would be a good idea that as a result of this meeting, we prepare a short communique, just a very brief document, which summarizes some of the key issues that we've learned in the implementation of the MOU, where we're going forward, and that we present that to the governing bodies, both UN Habitat's Assembly, which is coming up in a couple of weeks, and the World Health Assembly, which is next month. So at least this very informal document can show where we are as two agencies working on urban health issues. It can highlight to the member states who will be present on both sides what we saw or you saw as the priorities. You know, we'll keep chipping away at changing opinion and influencing our member states. But I think it's been an excellent opportunity for us to contribute our thoughts. I'm delighted that people online and everyone here has stayed predominantly with us for the whole session. I think it's been very interesting. We will aim to prepare this brief communique. We will, of course, share with you, ask for your feedback before we do that. So we're going to have to turn that around quite quickly, but we'll endeavour to do as best we can. And then, of course, aside from our dear colleagues in WHO, the Global Cities Hub, we're delighted. The influence that, you know, global cities have had on mayors through their activities, through their work with the pandemic treaty and in other areas is really important. We share the same ideas and mandates with what we want to do, and they're a very serious partner for us in this process, hence them being co-hosts in this event. So I think on that note, I'd like to thank all of you here and online for spending a little bit longer than we anticipated, but I think you'll agree it's been worth it. Thank you very much for your attendance.
Thank you very much.
Thank you.